Now, for more on the situation here in France, we can go across and speak to Dr. Yosu Luque, nephrologist at Paris's Tenon Hospital. Good afternoon, Doctor. Thank you very much for joining us here on France 24. Now, you've been tasked with caring for COVID-positive patients. Could you tell us what exactly you're seeing?
Good afternoon. I'm a nephrologist. I'm working with people with kidney disease. They may have a kidney transplant, they may require dialysis. These people are particularly fragile and they could be affected by the viral infection. So we see a lot of people coming for this dialysis unit with kidney transplant in our unit. We don't only see patients with other patients, but you also see patients 50 or 40 years old patients in our unit.
And do you have the necessary safety equipment to do your jobs, masks, gloves, etc.?
Yes, in our hospital in Paris, we have the mask and gloves and coats. Teams have the equipment, but this equipment is very valuable and worthy, and we don't have to waste it, so we have to use it properly. Big efforts are made by the teams, nurse teams, medical teams, to adapt to this new condition situation.
Now, Dr. Luque, you are a nephrologist. That means you treat people, with acute kidney problems. What about your patients who you would typically be seeing in intensive care? Are they coming to the hospitals?
It's interesting. That's quite surprising because we see much less people coming for other pathologies than COVID infections. So we don't know where these patients are. Are they at home sick, but they are afraid of going to the hospital? Or perhaps they will come to the hospital later with more acute illness or conditions. So in the hospital, we also have to preserve and to keep some units and some beds for people without the COVID infection. It's important too to keep this health care offer for them.
And very quickly, are you doing consultations now?
Yes, I'm doing consultations, but for people who are their homes, people who don't need hospitalization, we prefer to do teleconsultations, with the video or by phone to check their health status, and not to. We prefer they don't come to the hospital.
Okay, Dr. Yosu Luque, thank you very much for joining us here on France 24.